A very good evening to everyone, to all of our viewers. This is Vance, your Kopi With Vans here, back. That's right, as usual. Before we start, nowadays the weather is so crazy, so the coffee has been changed into a lot of water. So let's have a cup of water. I'm sure my guest speaker is also having his cup of coffee or water. So let's get to know that in a while. But yes, today's topic is very important. It's about snoring and sleep apnea. A lot of us have issue with sleeping, and it could be also be snoring. And we are going to talk a lot about that in with our expert, which is Dr. Jeeve Kanagalingam, ENT, consulting ENT head and neck surgeon. So please welcome Dr. Jeeve. Hi, Doc.
Hi, how are you,
Hi, sir.
Vance?
How are you?
Thanks for having me on.
Thank you, sir. So, are you having your cup of coffee or water in your end? Standby.
It's water, Vance, because we
Okay.
want a good night's sleep tonight.
Yeah, that's right. That's a topic today, Doc. Thank you, Doctor, for joining me at Kopi Events. And the topic, of course, it's very important to all our viewers and all over there. But before we go on, Doc, can you just do a quick introduction of yourself, please?
Yeah, so Vance, I'm a ear, nose, and throat specialist. So I work in Mount Elizabeth Novena Hospital in Singapore, as well as Gleneagles Hospital. And so I spend most of my time seeing adults and children with ear, nose, and throat conditions. And obviously, one of the common things we see is people with snoring issues. And I've been doing this for about 20 years.
Wow. Okay. So, Doctor, a lot of people right now, before the pandemic or right now, I think a lot of us know. I think snoring is seems to be like a very common thing. Uh, Only the poor spouses will know the other half how bad can it be, but it also affected the other half as well because they can be sleepless night as well, right?
Yeah, no, I think actually snoring is probably underestimated as a cause of a lot of marital unhappiness. So
Okay.
it obviously upsets the person you're sleeping with. And sometimes it takes a long time before this is raised as an issue.
Yeah, doctor. So I think we will go into the topic, doc. I know we have some slides, and also viewers are engaged to ask us questions. The last 15 minutes, as usual, we will try to answer all these questions. But in the meantime, we're going to understand a lot of on the part of snoring and sleep apnea as well. Doc, before we even go on, I did also a little bit of study before, not exactly for the MBBS, but before want to speak this topic. I noticed that the negative suction, the pressure actually pulls the soft tissue in our mouth and the pharynx inwards the muscles. So when I look at that motion, is that could be one of the reasons why people snore because the airway is not going through?
Yeah, so one of the main reasons for snoring is that your airway is collapsing. So if you have soft tissue collapsing in your airway, that's what's generating the noise that causes the snoring. And
Okay.
we'll start to talk about what bits flop and what bits collapse that cause the
All right.
snoring.
Can we dive
Yeah.
into your slides, doctor? I know you have prepared that for us. Thank you so much.
Yeah, no, sure. So I thought, Vance, we should just
Yeah.
start by talking to the audience about why
Okay.
sleep is important. And
Okay.
okay, it's a busy slide, and obviously you don't have to read everything, but I
Yeah.
think one of the first things which is important for in terms of sleep is actually how it helps us with learning and ensuring that what we learn goes into our hard drive. So often, if you see people who try and learn a task, if after they learn that task, they have a good night's sleep, you find that they're able to perform and remember the task much better. And obviously, this has a lot of implications in terms of kids. There's no point a child staying up late at night trying to learn things if they don't then follow with a good night's sleep, because all that you've learned is not going to go into your hard drive and memory. The second thing is obviously mood, and we all know that, right? I mean, if you don't have a good night's sleep, the next day you're moody, you're impatient, you're irritable. You become an unpleasant person to work with. So obviously, mood is highly dependent, on a good night's sleep. And then there are issues with metabolism and weight, and this is important, Vance, because often when you feel tired, what the body tends to interpret this as is that you lack sugar, you lack calories. So people who tend to have poor sleep tend to crave calories, and so they tend to eat more. And in fact, we know there is actually a hormone that sets your satiety center called leptin. And we know if you don't have a good night's sleep, that production of that hormone is disrupted, and people tend to eat more. And so it's very interesting. It's a vicious cycle, right? You don't sleep well, you eat too much, you put on weight, and as a result, because of the weight, you snore and you don't sleep well as well. So it's a vicious cycle. Then there's some sort of real sort of issues with poor sleep. One is obviously safety. If you don't sleep well, you're more likely to get involved in an accident. If you do a job, working a manual job in a factory, handling equipment, handling big machinery, if you don't sleep well, you're going to cause accidents. And then there are the two things which, as doctors, I'm most commonly concerned about. And one is the effect of poor sleep on your heart and health. And we'll come to talk about this, about how it will affect other things about your health. And then finally, there is, other than just your heart and your health, there is this issue of poor sleep affecting your immune system. So that there is good evidence that your immune system doesn't function as well if you're sleep deprived. And I think commonly people kind of sort of say these things like, oh, I've got a cold because I'm tired, or I've been working too hard, and so I get a cold. And there is some truth in that.
Well, doctor, I mean, we can see a lot of issues are just coming up just because of sleep, and I think it's not something like a Cinderella who can sleep until the prince comes in. On a lighter side, but on a serious note, like what doc you have said, blood pressure related to the impact on the heart and your pancreases and livers, and constantly. Because I was doing a little read up, like I said, I was looking at the air obstruction that causes a lot of, your cells don't get enough oxygen, and then your sleep get disturbed, and then you got very irritation, all the way. And then if this goes for years and years and years, probably the person may go into some psychological issues as well, because without sleep, I think you are going through some kind of stress mode as well.
Yeah, I mean, we see it all the time, right? People who are chronically sleep deprived tend to develop, problems with their mental health. And often when you see people who are completely stressed out, or have all sorts of issues, in their personal life and their relationships, you can actually sometimes, boil it down back to the fact that they're just not sleeping very well.
Doctor, I'm going to share some experience here. A couple of years back, I went for a photography trip with one of my brothers. Apparently, we have to share a room, and he was snoring without a silencer. So it's actually way much more louder than the F1 cars that we see. And I was like looking at him, and it's like, wow. So, but is it something that can be corrected, doctor? I know we have the topic, we have the slides, but I'm just offhand asking: is it have to go through some surgical procedures to prevent that, or is that something that you can do like remedies?
Yeah, so it's a as you can imagine, it's quite a complicated problem, and people snore for various reasons, and we talked about bits of the airway collapsing. And it can happen at various levels. It can happen at the level of the nose, the back of the nose. It can happen at the level of the throat, the back of the throat, the palate, and the tonsils. And then it can happen further down, the back of the tongue collapsing back. And so there are various sort of levels of obstruction. And very often what we find is that in one individual, there may be 2 to 3 levels of obstruction. And obviously, you can do surgery for some of these patients, and some patients, surgery works very well. You can address some of these levels of obstruction, but then there are other patients who, surgery doesn't work so well, and we have to talk about other things. But essentially, I think the message should be that, you shouldn't suffer in silence. Forgive the pun, but if someone is snoring, either yourself or your partner, there are things that can be done. They can be done. Yeah.
Doctor, I know we are spreading the topic. I mean, the same topic, but snoring and apnea. For still example, like I'm snoring, right?
Yeah.
Without the silencer, so loud, but I don't get obstructive on my airways, and I have a peaceful sleep. But the
Yeah.
partner is going through it. But how do we identify whether this person is going through a sleepless night? I mean, as me as a snorer, does
Yeah.
it affect my health as well, or my partner's health as well?
Yeah. So okay. So if we deal firstly with the person who's snoring, so if you're snoring, and you sleep perfectly well, you have
Yeah.
no issues with it. You wake up feeling rested, and you don't know what the whole issue is about. It may be that you are just a simple snorer, and there's absolutely nothing going wrong. You have actually good oxygenation, good flow of
Yeah.
air. It's noisy, but you're getting good flow of air and you're sleeping well. But the thing to identify is whether you may have this related condition called sleep apnea. And just for the audience, apnea is the Latin word for cessation of breathing or stopping of breathing. And so, you may snore, but then there may be periods where you actually stop breathing. And when that happens, oxygen levels drop. Now, that is obviously what is dangerous, and that may be causing some harm without you being aware.
Right, doctor. Okay, I mean, we talked about the sleep. So one have to be identified, or the spouse actually have to knock some senses to the husband or the wife and say, "Hey, you are snoring." But there are a lot of couples who are going through this day and night for years and years, decades and decades. But hopefully, they will find a solution to that. But we are also going back into these the common type of snorings. Some just snore for few minutes and then they just go off. Is that considered something that to look into, or someone just like 24 for the past 8 hours you sleep, you're just snoring? Is there also an issue with that, or do we see there's a softer side, it is a larger side?
Yeah, so it's interesting. So the truth is that snoring, whether it happens in bits or whether it's a continuous, you cannot tell just from listening or watching someone snore whether it is serious or not. The only way you can identify whether snoring is dangerous is really to do a sleep study. And we can talk about different types of sleep study, but I think a lot of people nowadays are wearing various gadgets, Fitbits, Garmins,
Yeah.
various things, Apple Watches. And I think those sort of things actually give you an idea about the quality of your sleep. So, I mean, to answer your question, can you tell whether, if it's just episodes of snoring or continuous?
Sorry, doc, we just lost you the last maybe 5 seconds of it. Doc, are you there? Okay, so looks like the connection went on and off, doc. So probably the last 10 seconds of what you have said has just paused. So we are trying to see if the connection coming back again. So we just give a while a bit. So right now at Kopi With Vans, we have Dr. Jeeve Kanagalingam, the ENT Clinic from ENT Clinic, Singapore. We're talking about the topic on the sleep, which is of course snoring and apnea as well. Members are actually our audience as well, especially if you have a particular question, you can actually ask us. We already have a few questions that's already been posted, so we are sorting out some things. So let me just see if we can restore the connection. Yes, doc. We have some. You are still okay. So right. Okay. So I was just sending a message to the doctor. There seems to be a connection issue right now. So yes, he has left. So he's going to log in again. We talked about a lot on the in the initial stages of the sleep. But okay, just give me a second. I'm just going to ask him to re-log in again. Can anything to be done to ease the snoring? Yes, I'm sure. We will let the doctor reply. Re-log in, please. Okay. Let me just get him. If not, today I'll be talking about snoring. Probably you all will be awake for the entire night. I mean, I love this topic about sleeping. Looks like a lot of people not having enough sleep. I got to guess. I got to say that because we work very long hours. We go work almost about 8 to 16 hours. I know someone who works for 23 hours. There's going to be lots of issue because if you're not having a good proper sleep, that affects your entire human system, right? There's so much of system that's working for you, working for us. But if we are not taking care of it, and then that's going to have a lot of issues pertaining to our health and especially mental health as well. You will feel burnout. You will feel exhausted. You feel like an angry bear, of course, without the beard. I mean, there's a lot of other remedies as well, if you ask me, in the non-medical related. Of course, you can listen to music, you can go for dance, you can even do certain things to calm you down. But I think if you have a certain issues that's pertaining to the ENT, which is ear, nose, and throat system, because it's not just a pathway or a passageway. I think there's a lot of other things that are working for us, and I was quite surprised to see when I was doing a little bit of a study on my own. There is, every time when we breathe in, I came to know that there is a negative suction pressure within us, especially it pulls our soft tissues in our mouth. And then the pharynx inverts the muscle in our pharynx, responds by pulling the soft tissue. So it's a very interesting to know. I wonder how doctors constantly go through this, and they know exactly what to look for. Let's see if Dr. Jeeve is back again. Let's see if the connection got back. Hi, doctor. You back?
Hi.
Okay.
Sorry about that.
Okay. I was covering certain topics on sleep, but non-health related. Thank you, doctor. Thank you for coming back and saving me in the right time. So yes, okay. we are talking about the topic on the snoring, the common snoring, and you were saying that the both sides are not the same.
Yeah. So I think when I left off, what I was trying to sort of say is that sometimes just the severity of snoring can't predict whether you have sleep apnea or not. So I think that's one of the issues. And what we tend to do when we see patients who have severe snoring or maybe be concerned is actually get a sleep study. And that is the really the gold standard in working out whether they have serious snoring or whether it's just simple snoring.
Right, doctor. So now a $1 million question, doctor. I snore. I got to be truthful. Okay. Do you snore?
I don't know. I've had no complaints.
No complaints. Okay. Okay. No news is a good news. No complaints is a good news. Doctor, we heard this, right? When you are tired, you snore. These are very layman terms. They do these old tales, wives, remedies. Oh, you snore because you are tired. You are exhausted. Put a pillow higher. Put the pillow lower. Does these remedies really work?
Actually, it's interesting. It's not so much positioning your head higher or lower, but sometimes lying on your side. If you snore and you snore, particularly when you're on your back, you may find that lying on your side, reduces the snoring significantly. And actually, quite a number of people actually have snoring, which is only present when they lie on their back.
Okay.
And that's partly because the tongue drops back or the palate drops back, and that's why the problem is there.
Yeah. Doctor, we have a question. Probably we might want to take it now, doctor.
Yeah.
So this viewer has asked us, hi Deepam, thank you for supporting Kopi With Vans and the questions. What's the difference between deep breathing and snoring? Yeah,
so it's interesting, isn't it? Because some people report this where they just breathe deeply at night. So there's no fluttering, there's no vibration in the sound of their snoring. And often deep breathing is not an issue. You can hear people breathe, but there's good airflow. Whereas snoring, you have that turbulent airflow where you get sounds of turbulence.
Right, doctor. Thank you, Deepam, so for that question. So we will go into even more deeper into that. Doctor, again, we still coming back to the snoring before we even jump into the few other topics. So if someone snores and the spouse is, of course, she's losing her sleep or he's losing his sleep, and can someone just leave and say, you know what, it's okay, I'm just going to live with it? Does it affect that particular person in the future as he gets older or wiser? Will it affect the system?
If it's just snoring and there is no sleep apnea, so they're just simple snoring, then it's not likely to affect them in a bad way, as long as the quality of sleep is good. So some people may snore, they may not have sleep apnea, but their quality of sleep is bad. And these are sometimes called sleepy snorers. So they snore, and when you wake up in the morning, they just don't feel that they've slept that well. And those patients are having some element of sleep deprivation, so their quality of sleep is bad. So those people, yes, it may have long-term implications.
Right. And we also know that, if you do not have the gold standard, they say gold standard. I mean, of course, people are sleeping 10 hours or 11 hours. But if you don't have a minimum 8 hours, and if you're snoring, and if you have obstructive airwaves, as we talk about, the soft tissue just collapse a little bit. Is it could be because of aging? Is like what you mentioned, doctor? Is it could be the aging also be a part of it? Or is it something that I inherited from my parents? Is there could be a link as well, as we're trying to go deeper into the topic?
Yeah, so there are a few interesting points, actually, Vance, you bring up. One is that snoring tends to run in families. So if you find that the things that you've inherited from your parents is the shape of your face, your mouth, the neck, and all those things are inherited in some ways. And so there are some people who, and I'm sure your viewers will notice this, that the whole family snores, and very often when I see patients in clinic who snore, they'll say that their father snored, or their brothers snore, and everyone snores. And so some of that's due to what you've inherited, is the shape of your face. And so there is some element of snoring being inherited. So that is true. And your second point was...
Sorry, you were saying something, Doctor. Carry on.
No. The one was the inherited element of it, and the second thing you mentioned was with age. And so obviously, as you grow older, people tend to put on weight, and the tissues of the pharynx tend to lose their strength and turgidity. So they basically tend to be a bit more floppy. And one of the things worth mentioning to your viewers is that estrogen, which women produce, actually increases the tone of respiratory muscles. So one of the reasons why women don't snore as much as men is because estrogen protects them until obviously they hit menopause. And then once they hit menopause, they're snoring as badly as men.
I was looking at the anatomy, doctor. The pharynx is something like a two. What do you call that? Something like a C shape, right? And then the oxygen, yeah.
So there are a few things that I think what you're talking about is something called the epiglottis and the tongues. So it's like a lid over the airway. And some people, that lid is pushed back a bit. And so it tends to cause more obstruction. So that,
Thank you, doctor. I mean, so much of things inside that we don't even understand. But many years back, doctor, I can't remember because I was actually snoring quite badly. So my parents said, you know what, you are snoring like a big elephant in the house. Nobody is able to sleep, and then also concerned about that. And I believed I was probably the age of 15. They brought to see ENT. And then he put some kind of a medication into the nose with cotton wool. It's with something. And then he pulled out, and then he put in something, and you're showing my parents. I clearly remember the tissue inside is swelled, and it's because of he was telling some diagnosis to my parents, and I got to go into my nasal sprays, and I have to monitor all that for a period of time. And this swelling, is it quite common as well? Because is it sinus or rhinitis? Are we looking at that spectrum as well, also, doctor?
So there are a few things that can swell, particularly in children. So in the front of the nose, Vans, you have something called the turbinates, and these can swell and cause nasal obstruction. In fact, you can actually see people's turbinates if you push up their nose. You can sometimes see a red swelling, and some people will come and see me and say, look, I've got this swelling in my nose that's causing an obstruction, and those are called turbinates. And turbinates can be very swollen. They can block the nose and affect your breathing. And then further back, so if you go further back into the nose, so this is what your COVID PCR swab sort of tickles at the back of the nose. Yeah. that is the adenoids. So the adenoids right in the back of the nose, that can cause nasal obstruction and snoring. And then finally, in the back of the throat, there are tonsils. And if the tonsils are enlarged. So I think you probably would have been a child. How old were you, Vance, when you saw the...
Probably, Doc. I mean, I can't remember accurately. Probably, I think I was probably below 40.
Yeah. So, you're essentially a child. And so the most likely causes would have been large turbinates, large tonsils, or large adenoids. And, large turbinates will respond to a spray. So it may be that the ENT gave you a spray, and you've grown up to be a big, healthy young man.
Doctor, is it the weather plays a part, the temperatures? It can also lead to a little bit of asthma. I mean, I know specialist consultant like you, work in a very tight place, right? I mean, you see through all these ear, nose, throat. I mean, how do you actually find the pathway, or that's an issue? How do you actually go into that in terms of diagnosis?
So obviously, you alluded to this. We have something called a nasendoscope, which is a little scope. And I think some of your viewers, if they've seen an ENT, it's probably one of the most common procedures we do, which is a little, almost like some people call it a wire, but it's a little fiber optic scope that goes into the nose. And so, obviously with experience, you know how to navigate through the nose, through the back of the throat, and down towards the voice box.
Doctor, just to stop you here for a while, without the GPS?
Yeah.
So you navigate without the GPS.
Without the GPS.
On the softer side.
Sorry, you caught me there. It's training. Okay. And obviously
years of experience.
Yeah, and some people are better at navigating than others. So some people may cause you a bit more pain than others when they do this. But so it gives you an idea of what's causing the obstruction.
Thank you, doctor. We're also going to go into the next question, which of course you already we've seen here. Is snoring dangerous? And there's certain degree levels of, a person has been like, just now we was talking about, the person stops breathing, even for a few seconds. That could be very fatal as well. On a serious note, when we talk about this.
So actually, that's interesting. So what happens is, and this is what we call sleep apnea. So I think I mentioned earlier, apnea is where you stop breathing for about 10 seconds. And so there are some people who snore, and when they snore, they stop breathing because the whole airway collapses completely. And for about 10 seconds, there's absolutely no flow of air. And when that happens, your oxygen levels in the blood drop. And your heart then thinks there's not enough oxygen. So your heart starts racing to pump more blood to the brain.
Yeah.
And if this continues, the oxygen levels drop further, the heart rate goes up further. And then at some point, you actually have what is called an arousal. So your body wakes you up and you start snoring again. And I some of your viewers may notice this in their bed partners where, they hear them snore, they go, and then suddenly they go, and they stop breathing. And sometimes the bed partner just is terrified because they think is this person going to start breathing again? But invariably, they start breathing again. So this concept of stopping breathing and then not waking up or dying in your sleep doesn't actually quite happen that way. So they always start breathing again. But the idea is that's not very good for the heart.
Wow.
And so, if this continues longer term, and we'll talk about this, increases your blood pressure. So you get high blood pressure.
Wow.
You can actually develop abnormal heart rhythms, something called atrial fibrillation. You can actually develop heart failure if it's very bad, and you can actually have a heart attack. So the effect of sleep apnea on the heart is quite significant.
Thank you, doctor. So it is dangerous to snore, right? For viewers watching there, if you have been snoring, you know what to do. It's not something that you should take it lightly and say that, you know what, I'm exhausted. You should get it diagnosed. You should get checked it out as well, like what Dr. Jeeve has said. Thank you, doctor. So we are going to go into this next one. Of course, we talked about apnea as well. So is it something a little different from asthma? I mean, of course, swellings and the bronchial tubes, that involves. But does ENT only works from shoulders and above? Do you also go below?
Not really.
Yeah, okay.
It's a ear, nose, and throat. So
Okay.
we stop at the chest. But having said that, we do share a lot of patients with our chest physicians, and a lot of patients with asthma will also have rhinitis. In fact, the figure is quite high. 80% of patients with asthma tend to have rhinitis, and about 40% of patients with rhinitis will go on and develop asthma. So it's linked,
There you go.
but asthma is quite separate from sleep apnea, because asthma is collapsing of the lower airways, where sleep apnea is collapsing of the upper airways. Yeah.
So a hypothetical question for you, doctor. I'm sure any question is easy for you, but this question coming directly from me. So this person has an acute asthma, and he has sinus, and he's also snoring. So which means that it has to be identified by two specialists. Am I right to say that? Or
Yes, yeah, that's probably right. But often you find that one of those three predominate. So, it may be that the main issue is sinus issues, sinusitis, and if you treat the sinusitis well, the asthma gets well, and then the sleep apnea gets better.
wow, it's a flow, right? It's a constant flow that one has been affected. Like we talked about the sleep. If you don't have a proper sleep, you're going to have a lot of other medical issues. So you got to solve the snoring part. So that's exactly a viewer has asked us. Thank you, Audrey Chan, for that particular question, which I think I just asked earlier as well. Is sinus anything to do with snoring? So she's just trying to relate with that. Does that happen that way, Doc?
Yeah, so it's interesting. I think when most people talk about sinus, what they mean is that a blocked nose. So obviously for doctors, the word sinus is actually part of the anatomy. But when most people say, I've got sinus, I think what they mean is a blocked nose, or they wake up sneezing and running. Now, people with blocked noses tend to snore. So they tend to snore because you tend to have to mouth breathe. So if you restore the nasal passages so that people are not blocked, they tend to snore less. But the important thing to say to Audrey is that sinuses and snoring may be very separate from sleep apnea. So you may have sinus and you may have snoring, but you may not have sleep apnea, or you may have sinus and snoring and sleep apnea as well. So certainly, if you've got a sinus issue, meaning a blocked nose or nasal blockage, nasal congestion, treating that should help the snoring.
So, doctor, to identify or to diagnose sleep apnea, it has to be done a study, right? The patient or someone have to come and sleep for 8 hours and then monitor.
We only need 4 hours.
Okay.
For a valid sleep study. But obviously, the more data we have, the better it is.
Right. Is it what are the common issues in Singapore, Doc? Is it a common issue?
Sleep
Snoring
apnea, yes.
and...
It is. Yeah, snoring and sleep apnea. And it's becoming increasingly recognized. So And I'll give you an example. So a lot of patients will find that they get high blood pressure at a very early age, and often, for no apparent reason, they've got high blood pressure. And increasingly, what we've been doing, we've been looking at these patients and doing sleep studies, and then we discover that they actually have significant sleep apnea. And so it is important actually to treat these patients and treat their sleep apnea uh, in conjunction with treating their high blood pressure. And in some of them, if you actually get them very early on, if you treat their sleep apnea, you may find that they then don't need medication for high blood pressure.
Right. Doctor, I mean, of course, we talked about these two aspects, snoring and sleep apnea. We probably, I understand, I'm sure viewers understand as well with the questions that's coming up right now. Keep your questions coming up. We will definitely wow, somebody has asked something. I'm going to bring that as well. But doctor, I mean, so when we talk about someone who's snoring and someone has a sleep apnea, is it a surgical have to be done, or is it with medication or steroids can be monitored before it can be reduced? Because some of them will be just worried about this procedure, and some might just want to prolong it and say, you know what, I'm fine. What are the challenges that we see here right now?
So actually, if you think in terms of sleep apnea, actually one of the things which is kind of underestimated as a very effective way of managing it is actually weight loss. And so
Okay.
a lot of patients with sleep apnea actually are overweight. And if you get them to lose weight, particularly around the neck and face, you'll find that you can reduce their sleep apnea quite a lot. And then the other three methods of treating sleep apnea are very simply surgery for some patients, but not all. The second is the use of CPAP, which is a specific machine they use at night. It's a breathing machine they use at night. It doesn't put oxygen into you, but it just puts air at a slightly higher pressure, and it helps you breathe, and that's very effective. And then finally, there's some people who actually all they need is just an oral device or a mouth guard, and they wear that, and they do very well, and they stop snoring and reduces their sleep apnea. So those are the essential three methods of treating. But really, the most important thing in a lot of patients is just weight loss. Yeah.
So weight gain is also one of the issues that someone is actually snoring as well.
Yeah.
With
So I
a
mean, a
contraction.
lot of people with obesity. Yeah.
Right. Thank you, Doctor. I'm going to take another question here. One of the viewers asked, is it okay if the windows are fully closed and the aircon on while we sleep? So she's probably thinking about the dust that's coming in. You got to watch your aircon as well. Change your filters. Make sure there's no dusty corners in your house, Udaya. But doctor, what is your take? Is it okay? Yeah.
So one of the things about air conditioning is it dehumidifies the air. So it dries the air that we sleep in. And that's probably not good for our nasal passages and airway. But if you look at the last few weeks, the weather's just been so hot. I think it's actually very impossible to to sleep without some air conditioning. But I tend to get people to use air conditioning for short periods of the night to try and set it in a way where it turns off, early hours of the morning, and maybe then have the fan on, because I think that ensures that you don't spend too many hours in dry air conditioned rooms. Yeah.
So, doctor, I mean, we talked about these two aspects, snoring and sleep apnea was very in depth that we covered. So now the next question, doctor, is let's say like a gentleman like me, like a man like me. What will be the best? Do I have to see an ENT on a yearly basis or 3 months once, just to make sure? Sometimes we only come and see doctor when there's a problem. When there's no problem, we stay away from them by having an apple. I mean, that's why they say have an apple to keep the doctor away. But what is the recommendation for annual checkup with the ENT?
So that's interesting. So if we are just talking strictly about snoring and sleep apnea? Or are we talking about general ENT?
General in a year.
Look, there are few things that probably are related to what your lifestyle is like, right? So basically, if you are a heavy smoker, and you probably drink more than you should, then you should probably have, on an annual basis, a routine ENT assessment. And this doesn't have to be done by an ENT specialist. It can be just done by your family physician, your GP. But to have a check of the mouth, the oral cavity, the nose, just making sure that that the smoking or the alcohol is not causing any damage. As you grow older, you may want to think about having a hearing test, right? So having hearing tests probably just to establish a baseline, and then deciding from there how often you should have a hearing test done. Checking your ears for wax, and that's something that most GPs can do very effectively. So I think it really depends on your risk profile. If you're not a smoker, you're not a drinker, you're a healthy person, then you probably may not need to see a doctor to have your ENT assessment on an annual basis. But I think if you're a smoker, or other thing that's worth mentioning is if you have a family history of head and neck cancers, nose cancer or thyroid cancer, then perhaps you should have an annual review with a doctor or an ENT specialist.
Right. So I'm sure viewers also know that it's very important that a medical checkup is very important, to make sure that your HbA1c, for your blood glucose level and your blood pressure. I think these are all very important. But also on a softer side, if you have a spouse that's always shouting near your ear, you probably might have tinnitus. But but that can be solved within a good solution by talking to each other, right, doctor?
Yes, it's always good to talk.
Yeah. Before we end this show, Doc, there's one topic, because I know one of the viewers actually asked us, but I said we are only talking about snoring and sleep apnea, but also talking about ringing in the ears, because certain age between the 35 to 45, some say that it can be induced by stress, it can be by inherited. What is your take on this in terms of tinnitus, if they keep hearing something like a ringing tone, that is non-stopping?
Yeah. So this is very good advice. So it's a very common condition, tinnitus, and it's very difficult to treat. But there are a few things that should make you see a specialist. One, if it's sudden onset tinnitus in 1 year, that means not both years, but you suddenly hear it in 1 year, and it's associated with hearing loss, then it's important to see a doctor soon and have an assessment of your ears and have a hearing test. So tinnitus that is one-sided is always worrying. But if it's tinnitus that you hear somewhere in your head, it's gradual in onset, then that's less worrying. Then the other thing is tinnitus that is what we call pulsatile. So it sounds like your pulse. Okay, so it's either crickets going ee or sh sh sh. Those sort of kind of tinnitus you should see a doctor about. So the two. So tinnitus is a mixed bag. There are all sorts of tinnitus, and it's about 9% of us have tinnitus in our life for some period of time. And I've had tinnitus. I don't know whether you've had tinnitus, Vans. For just brief periods, you hear it for a few minutes or a few seconds.
Doc, I definitely have it. I definitely have it. I remember when I was in Sec 4, I think I was caught smoking by my father. He gave me a slap, and it lasted me for probably 2 weeks. The thing. So I was like,
was it in 1 year?
Oh Lord, what is this? Sorry, Doc?
Was it in 1 year, Vans? Was it in 1 year?
It was
both
entire
years?
body. Both.
He slapped you on both sides.
Probably one side, but I felt it on the other side as well. So thanks, doctor. Because it could be also due to stress. Because due to stress, there are so many sicknesses that comes along the way. Is it also related to that? Is tinnitus related to stress?
Yeah, it probably is, and it can be related to lack of sleep. So we tend to see it in people who are stressed and lack of sleep. There's a feeling that tinnitus is due to abnormal electrical activity in the brain, somewhere in the brain. And obviously, if you're sleep deprived, if you're stressed, that electrical activity is perpetuated. And it's very difficult to address. And often when I see patients with tinnitus, I find that there are multiple causes. It may be stress, lack of sleep. There may be even a bit of wax in the ear. There are various causes.
Thank
But
you,
you're
doctor.
right. Stress is probably a common cause.
Okay. If it happens without warning, then I think you should check with the doctors, with Dr. Jeeve
Yeah.
as an ENT specialist. But if someone like a parent or your spouse, I think you should take it on your own. Please don't come and see us. That is perfectly fine. Thank you, doctor. I mean, the topic on the snoring and sleep apnea has given us so much of information on that, how serious it can be. Even though some taking it as on a lighter side, they say, you know what, I'm just snoring, I'm tired, put a pillow. There's so many remedies, but you have actually explained it so clearly and with so much of information pertaining to this. And I think you also covered on tinnitus as well. Thank you so much, doctor.
Thank you.
Any final wise words that you want to tell our viewers before we call it out?
It's a bit corny, but basically, don't suffer in silence if you snore. Or if someone in your house snores, you should bring it to the attention of a doctor or an ENT specialist or a sleep medicine specialist and have it investigated, because there's a lot that can be done. And even, if it's just simple snoring or if it's sleep apnea, it can be, pardon the pun, a silent killer. So snoring can be a silent killer if you don't address it.
Thank you so much, doctor. It is indeed a fantastic period of time with you, doc. I think over the past 2 days when I visited your clinic, show me some of your models on the system of the ear, throat, and nose. I think it was amazing. Thank you for your time with us at Kopi With Vans for the past 1 hour and talking about the topic on the snoring and sleep apnea. Thank you so much, doctor.
Pleasure, Vance. Thanks for having me on.
Thank you so much. See ya.
Bye.
All right, viewers. That was quite a... So today's a lot of jokes came in from me. But was an amazing session by Dr. Jeeve Kanagalingam from the ENT Clinic. I think EF actually talked to us a lot of information pertaining to that. I can see a lot of messages that's just coming in as well. Thank you once again, Dr. Jeeve Kanagalingam, consultant ENT, head and neck surgeon from the ENT Clinic. Thank you so much on this pertaining on this topic. Viewers, if you have more questions, you can actually ask. You can just type into the comment, and I probably will, if Dr. Jeeva's time allowed it, if allowed, then we can definitely answer it. Thank you for your time, and I think it's time for me to say adios, amigos. If you do have any topic that you want us to talk about pertaining to health, I think I'll be very more than happy to bring this topic in, and especially this topic on ENT we have never covered over the past 2 years, 6 months. And I think it's very important as well because, like what Dr. Jeeve has said, if you are sleep deprived, it can lead to a lot of other issues as well. Even when you talked about the sleep apnea, when you stop breathing for 10 seconds because of this obstruction that is in your airways, that actually causes a lot of pressure to the heart. It gives you pressures a lot to your lungs, and so many things can happen. So many things can go wrong in different levels in our human body. But sometimes we only react when things go wrong. So I think that is where prevention is better than cure. And lovely presentation by Dr. Jeeve Kanagalingam. My greatest thanks to him with lots of information that he has spent over the past 1 hour with us. So thank you, Dr. Jeeve, and I'll be catching you again next week, Wednesday, 9 p.m. on a different topic, but this topic is going to be really sexy. First time ever in social media, we are going to talk about this. Again, brand new topic coming your way at Kopi With Vans. It's time for me to say sayonara. And as usual, I'm going to have my coffee at the back end. So I'll catch you soon. Catch ya.